We have had 923,430 cases, 870 new cases reported since yesterday, 982 people in the hospital, and sadly, 12,189 people who've died. Our prayers are with those who've lost loved ones or who are battling this virus. This week is Public Health Week, and if there's ever a time to thank our hard-working and dedicated public health workers across the state, it's now. Your work has always been important, but this past year underscored just how critical and heroic that work is. Thank you for all you've done, including sacrificing your own safety to save the lives of North Carolinians. North Carolina's COVID-19 metrics have remained stable over the past month as we've cautiously eased restrictions. Our percentage of tests returning positive remains steady and the number of hospitalizations has leveled. This is good, and our Secretary of Health and Human Services, Dr. Mandy Cohen, will share more about our numbers in a moment. Although North Carolina remains in a stable position, we cannot let our guard down. This is especially true as we see rising numbers in other parts of the country and across the world. This virus is still out there, and new, more infectious variants are spreading. We need to continue to be careful and responsible. I know that as summer approaches, many people are curious about how things will change and what to expect. We're consulting with health experts, hearing from businesses and their needs, and following the science and the data. Soon we will be giving you a forecast of what to expect as the summer approaches and some of the things that we can safely do by July the 4th. We remain focused on getting people vaccinated as quickly and as equitably as possible and continuing to slow the spread of this virus. The more people we vaccinate, the more we can safely do. North Carolina continues to make progress on that front. As of today, more than 5.2 million vaccinations have been administered in North Carolina. Almost 40% of our adults are at least partially vaccinated, and more than a fourth of our adults are fully vaccinated. Particularly important is that our most vulnerable population, those people 65 and over, is gaining protection every day. 73% of them have had at least one shot, and more than 65% of them are fully vaccinated. Tomorrow, Group 5 becomes eligible for vaccine. That means anyone 16 and older can sign up for a shot. This is great news. Because of the hard work of our providers and commitment of North Carolinians to take their shot, we're getting people vaccinated more quickly than we predicted. This will help us turn the corner on the pandemic even sooner. But the work isn't over yet. We have to keep up our safety measures like wearing our masks, especially indoors. And we have to encourage each other to get vaccinated. If you know a loved one or a friend who's hesitant, make sure you talk with them about why it's so important, effective, and safe. It's the key to saving lives and moving us forward. And we all know that the most common side effect is pure joy. I've seen that relief and sparkle in people's eyes at every vaccination clinic that I've visited. We are so close, and every day counts. Every time we wear a mask makes a difference. Every person who gets a shot makes our whole state safer and healthier and helps move our economy forward. If we all do our part, we can put this pandemic in the rearview mirror once and for all. At this time, I'll recognize Dr. Cohen to give an update on our COVID-19 metrics. Dr. Cohen.
Thank you, Governor. Let's jump right into the data and look at our 4 key metrics: COVID-like illness, cases, percent of tests that are positive, and hospitalizations. On our first slide, we look at graphs from a graph from people who come to the emergency department with COVID-like symptoms over the past year. And you can see when looking at that yellow line, we are getting close to our baseline, which is good news. Next, we look at our cases since February. And you can see our cases have leveled. This is good news as other regions of the country are seeing increases in their COVID cases. We also look at the percent of tests that are positive since February, and looking at, again, that yellow line, the percent of positive tests is level and has been averaging around 5%. And finally, we look at day-over-day hospitalizations since February, and you can see, again, looking at the yellow line, that this trend is also level. Okay, so here is where we are overall. Surveillance data is getting close to baseline. It gets a green check. North Carolina's trajectory of cases has plateaued, and with those new variants the governor mentioned, we need to keep our guard up. Cases does get a yellow line. North Carolina's trajectory in percent of tests returning positive has been at our 5% goal. This does get a green check. And North Carolina's trajectory of hospitalizations is level, but still elevated. It does get a yellow line. Now, let's look at what's happening locally. On this slide, you see our current county alert map. And we've added 2 new color categories so we can show our continued progress. We now have a light yellow that here represents a little bit white to show moderate spread, and green for low spread. This is the first county alert map where there are no red counties, and this is great news. While the number of orange counties increased from 21 from a previous 17, close to half of the counties in North Carolina are yellow. 31 counties now fall in this new light yellow category, or moderate spread, and we have a green county, Allegheny County. Our fast and fair approach to getting vaccinations to people is really showing results. And as of today, 39% of all North Carolinians 18 and older are partially vaccinated, and a quarter are fully vaccinated. And this past week, 19% of first doses went to people who identified as Black or African American, and 10% went to Hispanic Latinx. And here in North Carolina, we've gotten national recognition for closing that racial and ethnic vaccine gap that's been pervasive around much of the country. And lastly, the vast majority of those at highest risk of serious illness from COVID have been vaccinated. As the governor said, 73% of North Carolinians 65 and older have received at least a first dose, and close to 2/3 are fully vaccinated. We're continuing our efforts to further reach those older adults, particularly those who are homebound. Tomorrow, we take another great step forward in our battle against this pandemic. Anyone 16 and older will be eligible to get their COVID vaccine. All 3 vaccines help protect against this virus and prevent hospitalization and death. For now, only the 2-shot Pfizer vaccine is authorized for 16 and 17-year-olds. Our vaccine finder at myspot.nc.gov provides brand information to help young adults find where they can get their Pfizer vaccine shot. You can get more information about vaccines at yourspot.yourshot.nc.gov. These tested, safe, and effective COVID-19 vaccines will help us get back in control of our lives and back to the people and places we love. Things like safely hugging a grandma, or traveling to see vaccinated family or friends, or having dinner with your vaccinated neighbors. New guidance from the CDC says that if you're fully vaccinated, you can travel within the United States. As the governor noted, we did not get here by accident. Our progress is the result of North Carolinians doing what it takes to protect one another day in and day out. And none of it could have happened without our public health workers. And as was mentioned, it is National Public Health Week, so I want to give them a special shout out from me as well. To all of our public health workers, thank you. Thank you for the incredible work you've done to protect North Carolinians and save lives. You've witnessed devastating tragedy, sacrificed so much, and met the challenge each new day of this pandemic. I'm grateful to each and every one of you. Our public health workers have saved countless lives by providing access to testing, getting masks to people, helping businesses and schools and organizations implement best practices to slow the spread of this virus, and they've been educating our communities about the 3 Ws. And now they're helping to get vaccines to everyone in our state. Thank you for all you do. Now, we're making positive progress, but our work is not done yet. Keep wearing a mask, waiting 6 feet apart, and washing your hands while everyone gets a spot to get their shot. Thank you, Governor.
Thanks for your continued hard work, Dr. Cohen. Also with me today is Emergency Management Chief of Staff Will Ray. Our sign language interpreters will be Lee Williamson and Nicole Fox. Behind the scenes, Yasmin Mativier and Sarah Arredondo are our Spanish language interpreters. I will open the floor for questions now, and if you can identify yourself and your organization, we would appreciate it, and we'll take the first question.
Our first question is from Caroline Hicks with WBTV.
Hi, thank you for taking my question. As we look at kind of where we began with this vaccine rollout and where we are with, opening to the general public tomorrow, I guess I just kind of wanted to get your reaction. Did you think that we would be able to do it this quickly in, less than 4 months? Or kind of what are your thoughts as you look back on what we've learned over the last 2 months?
I think this trail of research and development of vaccines and the way they have been pushed out across the country and the world has been an amazing story. I give a round of applause to all the researchers and scientists, many of whom were here right in North Carolina, who had a part in vaccine development, also in therapeutic development. And the fact that the manufacturing has continued to occur and that we continue